Hi, I'm Dr. John Young, medical doctor.
Hi, I'm Alex. I'm a nurse practitioner.
And we're going to do a little bit of talking about a problem that we see quite often in our clinic. And Alex, why don't you start?
Right. So we've been seeing patients today all day, and I just got a question about a patient. We often get this question, but I think because it's been a little bit colder, the weather's a little bit chilly here, so we've been getting more patients with a lot of joint pain. They get stiffness of the joints, the knee hurts, the elbows hurt. And I just got a question today from a patient saying that she has some inflammation in her elbow, and her doctor told her that she should get an injection of a steroid injection. And she asked me if I could do that for her here. I said, well, we actually have something else. We have something probably better for you, and we call that PRP. And she asked me, what is PRP, Dr. Young?
PRP stands for Platelet-Rich Plasma. And think of it as it's all the fertilizer you're going to put on your yard just in one little area. It's all the growth factor, all the things you need to repair. And you're going to put it right in there. The reason why we're not real big fans of steroids is you're kind of kicking the problem down the road. Put that anti-inflammatory in there. You're happy for a week or two. But are you really healing anything? And steroids can also mess up a joint by weakening tendons and muscles and things like that.
Is that why they can only do like a few times? They can't do a lot.
Right.
A lot of steroid injections. Because they go back to their doctor and they're like, it still hurts. I need another injection. And they say, no, I can't do it again.
Right. Most doctors will maybe do 2 or 3, in a year or whatever, just because over time it accumulates and it slows the healing process.
Okay. So with the PRP is different. You actually help the healing to take place and the joint get better by healing, not just slowing the inflammation.
Right. There is some inflammatory aspect to it.
Okay.
But what you're doing is we take about 4 vials of blood, just draw it from you. We put it in a centrifuge and spin it for about 20 minutes. And that serum, that
that clear
stuff, we take out. And that is filled with some stem cells. Okay. But it's really filled with platelet growth factor, which is all these factors that cause the body to heal quickly, you might say. So we're putting all the fertilizer right there into that joint.
So you're really just injecting your own blood.
Right.
So there's no reaction. You can't have a reaction to your own self.
Unless you have an allergic personality.
Right. And what kind of conditions would you recommend that?
I think acute injuries, something like I overworked my elbow this weekend or shoulder. We use that a lot. Or people that just said, I've been doing the steroid shots. It's not getting better. It's been months now. And I'll say, let's put some in and let's see if we can get it to really heal. And so we've done it on chronic knee problems.
Okay.
Arthritis of the knee. We've done it on disc problems.
Okay.
It's interesting when you add, some German studies are showing when you add ozone gas to PRP, it really seems to make the meniscus, that material in the knee, the cartilage material, and in the disc in the back, to really repair quickly.
So now that we're going to the next level also.
Right.
We're doing the PRP and we're also adding ozone to that injection that speeds up the process even more.
And it seems to make a big difference. So it's another tool you have versus, all right, we'll give you some stronger pain medicine or whatever. But we've been very pleased with our results. I bet you we do 5 to 6 every day in our clinic, and we've been doing that for years. It just, the drugs are great, but the problem is long-term use of a lot of these painkillers, the steroids, it actually retards the healing process.
And one of the problems that I encountered with the specific patient that I had is that she cannot take oral anti-inflammatories because she has a problem with her stomach. So she can't take over-the-counter anti-inflammatories, the NSAIDs, because it will hurt her stomach. So she's avoiding taking out these anti-inflammatories for months. And an inflammation like in a joint, like an elbow, can go on and on for many months.
Right.
Is that right? So with the PRP, what are we looking at as far as healing? How long does it take?
I say to patients, before saying it didn't work, in most of our patients, we've learned this. You probably have to inject them 2 to 3 times.
Okay.
A lot of them one time and they're happy.
Yep.
But for a very chronic knee or shoulder, elbow, you may do it 2 or 3 times before I would say it's just not going to work for you.
Gotcha.
And you can do it. We will do it like every 3 weeks, 3 to 4 weeks, and then either they're really fine or it's no sense in going on.
But the good news is there's no reaction, so
Right.
you're not going to hurt yourself in the long term,
Right.
because that otherwise would happen with the steroid injection.
And what we're finding is that even some of the insurance companies cover this shot.
Well,
so
that
makes it
depends on the insurance
Right.
company. You can check that too.
Right.
That's great. So there's some also I've read studies about athletes that they actually been treated like that with PRP. So like you said in the beginning, if you are, just had an injury recently, and you can do that and also help to recover.
I've had a number of players that played college tennis come in, and they're pretty pleased with their results. They're back on the court, no problem.
Yeah.
So it is really something that you're seeing more and more. I know the NFL is using it, the PGA, Major League Baseball.
Yeah, I know that. Yeah.
So
It speeds up their process because
Right.
they gotta go back to the game.
Right.
So that's great. All right, so that was all we had for you today, Dr. Young.
Well, I hope that people enjoyed it because it shows you that there's something else besides ice, rest your elbow, or whatever.
Yeah.
There is something that really is valid, and a lot of these big high-priced athletes are using it. So if it's good enough for them, it's good enough for our patients.
That's right. Thank you so much.